Hospitals across the United States are being overwhelmed with COVID-19 patients. The 7-day average hits more than 200,000 cases a day. Hello, I'm Arnold Naidu, and this is The Heat. With each day, the COVID-19 pandemic is getting worse in the United States. More than 15 million people have been infected, with more than 285,000 deaths. And health experts warn January could be even worse. California's governor issued a stay-at-home order for 33 million residents in an effort to ease the burden on the state's hospital system. Restaurants can no longer serve inside or outdoors, and hair salons and playgrounds will remain closed until January. New York's governor also warned if the hospitalization rates don't soon improve, indoor dining will be shut down again. In a sign of hope, U.S. President-elect Joe Biden pledged 100 million vaccines in his first 100 days in office.
This team will help get at the last 100 million COVID-19 vaccine, at least 100 million COVID vaccine shots into the arms of the American people in the first 100 days. 100 million shots in the first 100 days. And we'll follow the guidance of science to get the vaccines to those most at risk.
Well, for more on the U.S. pandemic, let's bring in our guests. Joining us from Washington, D.C., Dr. Kate Tulenko is the CEO and founder of Corvus Health, a global health firm. And from Jackson Hole, Wyoming, Dr. Deborah Davis is an epidemiologist who advises governments and policymakers. Thank you to both of you for joining us. Deborah Davis, let me start with you. We continue to see these alarming numbers in the United States. An average of 2,249 people died every day this past week. That's the highest we have seen since the pandemic outbreak. What's behind these increasing numbers?
Well, unfortunately, we're seeing the consequences of what happened over our Thanksgiving holiday, which was just about 2 weeks ago. As many public health experts warned, if people were to travel and visit with family members, even though they felt that they were being safe, they actually were effectively transmitting and sharing the virus. And that's what we are seeing right now. The consequences of that holiday celebration have come home to roost.
We often hear about the numbers and the situation in big cities, but what about where you are in Wyoming? What's the situation there?
Well, we are facing a problem here as well in our small rural communities because we don't have as much access. In fact, the state makes free test kits available to people, but sends it by mail, and you can send it back in with those results and get the results within a few days. But the positivity rate here is increasing as well. And the problem has been that bars and restaurants in Wyoming remain open, although they're being closed in California and restricted and curtailed in other hotspots in New York. So I think that when people go to shopping in malls, they can wear masks. But when they go to a restaurant or a bar, you can't wear a mask. People tend to talk loudly. In fact, one advice I can give you is if you go into a room and there's loud noise, leave, because you don't want to be indoors where people are talking loudly, because with projectiles of droplets, you can get transmission of the virus.
And Deborah, are most people in Wyoming complying with the restrictions?
You know, I can't tell you about most people. I can tell you that in Teton County, I think there's a lot of compliance with the restrictions. Even at the ski resort, the operators are refusing to let people get on unless they have a complete covering over their nose and mouth. But you know, it just takes one person to ruin it for everyone. And unfortunately, I don't think that message has gotten through sufficiently, certainly not in this area.
Kate Tulenko, the healthcare system is coming under pressure. Very heavy pressure in some parts of the country. We'll look at California. The California governor has issued a stay-at-home order for 33 million residents because hospitals and intensive care units are at capacity. How serious is this situation, and is it likely that we could see these restrictions happening in other parts of the country as well?
So the situation is quite serious, and I do expect it to get worse and unfortunately to extend to other states as well. As was mentioned, we're seeing the consequences of people's behavior over Thanksgiving, and I think also after Christmas, in the few weeks after that, we'll see spikes as well. And we will see more states instituting crisis standards of care, which means that some people won't have access to ICUs, whether you have COVID or another injury, and other people won't have access to life-saving treatments such as the antivirals and the monoclonal antibodies.
Joseph Williams, a big focus right now on vaccines, the provisions of vaccines. The New York Times had a report which said that the Trump administration rejected an offer from Pfizer, that's a pharmaceutical company, to buy additional numbers of vaccines, of doses. The White House has denied that report, but what do you know about it?
Well, what we know is that back when the virus was rounding the corner, when people were, pharmacy companies were starting to get a grip on this, and the tests were promising, the White House had an opportunity to buy an additional number of vaccines over and above the 100,000 that they have now. 100,000 that they have now, and that would have allowed them to lock in a lot more doses and be able to take care of more of the population than they can right now, because right now they can only take care of a very small portion after the frontline workers. So the White House kind of booted this one in that Pfizer came to them, offered them an opportunity to buy a larger batch of the vaccine. They chose not to. As a matter of fact, they didn't even respond to Pfizer, and Pfizer ended up taking those vaccines and selling them to Europe, where we already are seeing vaccines starting to happen, including in England, where the first vaccinated patient happened today.
Joseph, as I pointed out, the White House has denied the report, but why would they deny an extra batch of vaccines?
Well, they were trying to hedge their bets in a sense. They were negotiating with other pharmacy companies, including the ones that have created an additional vaccine. The White House's logic at that point was, well, we don't know if the we don't know if the vaccine is going to work. It's still in the experimental phases. If we lock in early and there's another vaccine that's more effective, we'd rather pivot towards them. But instead, they placed their bet on the wrong horse. Pfizer came out first for the gate. Its vaccine was 95% effective. The White House ended up getting stuck with a lower volume of doses than they could have had, and that led to President Trump's signing ceremony today, talking about how America first, all the vaccines that they have in the U.S. are designated to go to United States citizens, but that's really kind of a show move to try to cover up for what happened back when Pfizer offered him to buy a larger amount.
Deborah Davis, researchers have confirmed that the Oxford AstraZeneca vaccine is safe and effective. In fact, there was a report in the British medical journal, The Lancet, which said that the vaccine has a 70% effectiveness. But there are still questions over the dosage, the amount that could be injected into someone, and the efficacy in older adults. What can you tell us about this?
Well, that's one of the problems that we have. We are basically doing an experiment on ourselves. It's unavoidable given the nature of this virus. I don't think there's really much of an alternative to the situation that we face right now, quite frankly. The idea that we're going to give the vaccine to citizens is ridiculous. Viruses don't distinguish between citizens and non-citizens. We're all in this together. And to think otherwise is really very, very foolish. That's why I was pleased to see that the Biden administration has made a commitment to 100 million doses in the first 100 days, and I hope that they're going to be able to live up to that. The Oxford vaccine trials are impressive, and unfortunately for all of this, the proof will be in the pudding, and we will have to see what develops. There will be side effects. It's unavoidable under this circumstance, but we don't really have an alternative at this time.
Deborah, when you say the proof will be in the pudding and we'll have to see, what kind of timeline are we looking at? How far from now will we know, well, look, this is working, this is bringing the number of infections down?
Well, just as with other vaccine programs, we know that there will be a small number of people that will have serious problems, and that is not something that we can predict precisely. So far, it doesn't look like it's going to be very large numbers. The reported rate of complications is less than 0.01% so far, but I want to stress so far because we have not tested even 1 million people right now. And as more people are exposed in the human population, we have a bell curve, and there will be some people that will fall out at the extremes, and they will have a much more serious reaction than most. And that's why I say that we have to wait and see what the effects will be. But at this point, I feel pretty confident that we have a number of alternatives out there. There are also, our vaccines reportedly in Russia and China, and they have not been fully vetted by Western standards. But there's going to be a huge amount of competition for, and we'll have to see which ones show up with the best ratings overall.
All right, at this point, let's welcome Harry Hull to the discussion. He joins us from Reno, Nevada, and he's an infectious disease epidemiologist. Harry, great to see you. We're talking about the COVID situation and some of the numbers I mentioned earlier. In the past week, we've seen an increase of an average of 200,000 cases a day across the country, and up to 2,249 people dying from COVID each day the past week. What is the situation like where you are?
The situation where I am is not good. We're seeing increasing numbers of cases. And in fact, our hospital has turned one floor of their parking garage into an auxiliary treatment unit for people with COVID. And in fact, that has 40 or 50 people in it right now. So our hospitals are getting overloaded. And, we're a semi-rural area, and normally if people are really sick, they would be transferred to California or Salt Lake City, but the hospitals there are filling up, and that's not going to be an option. We have to treat them here. And I think that that's a situation that is occurring all over the country, that rural areas are seeing more and more cases, and the option for transferring those patients to the more sophisticated urban medical centers are just being closed off because of the volume of cases nationwide.
Harry, a great deal of hope is being invested in vaccines. We've been talking about that. Of course, we heard that Britain has already started its vaccination program. But what is the situation here in the United States? We heard the President-elect Joe Biden tell us that he hopes to have 100 million doses of vaccine out there in his first 100 days in office. Does that look like something that can be done?
I'm hoping that it can be done, but there are all kinds of problems that can occur. And it's not just a question of the vaccine. We have to have enough needles, enough swabs to sterilize the skin, and enough people to administer the vaccine. Here locally, our drugstores are offering to give the vaccine, but they really don't have the capacity to do that. So they're looking to hire additional people. But again, it's a question not just of the vaccine, but of the whole logistics of administering the vaccine. Just organizing the people to come in. Right now, with a limited number of doses, we're able to go to nursing homes and to vaccinate medical staff. But we've got to be able to organize to be able to vaccinate hundreds of millions of people nationwide, and that's a difficult job.
Kate Tulenko, the country's premier infectious diseases expert, Dr. Anthony Fauci, he says the worst is yet to come. Let's listen to some of what he had to say.
And what we have now is a challenge ahead of us of the bleak months of December and January, where we have a baseline of infections that literally is breaking records every day with regard to number of infections, number of hospitalizations, and numbers of deaths. The numbers are really stunning. We can do something about it, but that something right now is public health measures.
So, Kate, as Dr. Fauci says, if the next 2 months are going to be very crucial, why isn't the government ordering more lockdowns in more places around the country? Or, as Dr. Fauci says, is it going to be measures like masks and social distancing? Is that going to be enough?
Well, the current administration has mainly put it up to states to institute public health measures such as mandatory masks and social distancing and closing of bars and restaurants. And so I think it will be up to the governors to do that. But I agree with Dr. Fauci that I think it will get worse, because even if we're able to vaccinate several million health workers and nursing home residents over the next 3 weeks in December, they'll need their second dose 3 weeks later. And both Pfizer and Moderna have said said it's 7 to 10 days after the second dose that they think people have full immunity. So even those people won't be protected until January. So I do expect to see cases spike. We certainly will have a lot more information over the next few weeks about side effects and what type of side effects we see in the general population, but we know from the phase 3 trials that number of serious side effects were quite low.
So, Kate, if we're looking at full effectiveness, then we're talking about something like 3 or even 4 weeks.
Yes, yes. And that's just, for the first round of healthcare workers and nursing home residents. Most people in what's often called now, the third tier. The first tier is health workers and nursing homes. The second tier is high-risk people with hypertension, diabetes, and the third tier is the general population. We won't expect most people in the general population to be able to get a vaccine until probably the second or third quarter. I like the fact that Biden says that he'll be able to get 100 million doses out, but I haven't seen the plan. It's not clear who's going to make these vaccines and how they're going to be distributed.
Right, and Joseph, talking about the plan from President-elect Joe Biden, he has announced his his health team. The man chosen to lead the HHS, that's the Health and Human Services Department, is Xavier Becerra. Well, this team will certainly have its work cut out as soon as they come to office. What can you tell us about the team? And most importantly, how will what they do differ from what the outgoing team has been doing?
Well, the team, as you mentioned, is made up of a bunch of experienced political hands who also happen to believe in science. In addition to Xavier Becerra heading HHS, you have Dr. Vivek Murthy, who was Surgeon General under President Obama, so he was in Obama's final term, and a range of other experts who are decidedly more different than Trump. Indeed, the experts that we have in the Biden administration who are coming in, they are science-based. They are probably more likely to take an aggressive stance. As you recall, President Trump had Dr. Anthony Fauci, who was also staying on for the Biden administration. He was the point person who was supposed to be one of the point people. But over time, as the virus grew more and more serious and Fauci got more and more airtime, President Trump managed to pull him back and rein him in. And towards the end of President Trump's term, he wasn't even bothering to have briefings on the virus, mainly because he felt like it distracted from the political angle of him trying to run for re-election. So in a very key way, at least in that key way, it's going to differ from Trump to Biden in that Biden understands that this is job one. This is not something down the line. This is not something that's a rating-based TV show. This is something that's costing upwards of 1,500 lives per day and untold damage to the economy. And unlike Trump, Biden understands, at least in his rhetoric so far, that in order to make the economy better, which is probably what President Trump had in common with President-elect Biden, is that the economy needs a boost. It's not going to recover until the virus gets taken care of. The virus is going to have the last word. So I think in Biden's understanding of that, he certainly has displayed that kind of an understanding in his picks, particularly with keeping Fauci on, bringing back Murthy, and bringing Becerra aboard. As you recall, California was one of the early hotspots.
Right.
So I think that his team alone signals that he's taking the virus far more seriously than Trump did.
Right, so I guess it's fair to assume then, Joseph, that we'll see far less politics and more science.
That's in a nutshell. I mean, certainly the virus is taking over just about every function of government, and the vaccine is a rescue beacon, but it's far on the horizon to get the number of people vaccinated, in part because the Trump administration sold it. So I think that in order to get things going, it has to be the first thing on the list, and politics has to be absent of that discussion.
Right. Deborah Davis, there's been a big debate going on about safety issues in schools, especially for teachers. We look at New York City, for instance. They've reopened schools for elementary schools, that is. Middle schools and high schools remain closed. What do we know about COVID and its effect on younger children?
Well, although there is a rare syndrome that can affect children, in general, young children are not as affected by this. I want to say something about Javier Becerra that I think is really important and distinguishes him from others. He has spent his life working to advance minorities. He is the father of daughters. He's married to a physician. He's well aware of issues of women's health, but he's also been profoundly involved in attempts to create more equity in our healthcare system. And we know that when it comes to COVID deaths in the United States, the chance of dying of COVID is much greater for people who are Black and brown, who have comorbidities. And I think there's going to see a real targeting of that. The National Academy of Sciences issued a report over a year ago that indicated that in cases of pandemic or situations like this, we should give priority to those who are most disadvantaged, because they are often the frontline workers, the ones who clean hospitals and take care of people. As to the schools, I think there's generally an understanding now, as opposed to in the beginning, that young children themselves are not the vector, the risk. But the problem is young teachers, if they want to hang out with one another and drink and have social lives, have to make things worse, because the teachers themselves then are going to be the transmitters of the illness. But generally, we know that young students really need school. They need school. They're not learning as well in front of computers. There are all kinds of issues that have been raised about the efficacy of learning and the damage that we're doing to young developing kids. So putting youngsters in schools generally is a good thing, but there have to be provisions for controls, for mask, hand washing, and the like that have to be enforced across the board in the schools, and especially with teachers.
Yeah, but Deborah, talking about Xavier Becerra, isn't one of the big problems in this country, and one that still has to be overcome, is the fact that Becerra and his team may have the best of intentions, but this has become so politicized that there may be large parts of the country that will not be listening to them.
Well, that is why it's so important that former presidents Bush and Clinton and Obama have all said they will be vaccinated on television, and that there will be an effort for leaders to lead here and to set by example. And I think that you're going to see a lot of that. You're going to see members of Congress and others who are minorities, where there's a lot of skepticism, for good reason, about the healthcare system. We've had some sorry stories in the history of public health with respect to discrimination against minorities from the healthcare system. So that skepticism is well earned, but that is why it's going to be very important to have General Austin leading the Defense Department, Mr. Becerra leading HHS, because it's going to take a combined effort. This is not going to be just something that the healthcare sector has to deal with. This is going to require, and there's already coordination that has been started with the Department of Defense to help enhance the distribution of the vaccine, as well as ensuring that it gets used by people more broadly.
Right. Harry Hull, looking at the impact of COVID-19 on young people, on school children, these vaccines have not yet been tested on anyone under the age of 18. Would that be in the next phase of the trials? I mean, when would young people be tested?
Well, we need to go through the process of testing the young children, and that will require separate trials, and it'll take time to organize that. But I think we have to remember that the supply of vaccine is limited right now, and it really needs to be directed to the individuals who are most likely to get sick, be hospitalized, and to die. And we also need to make sure that we vaccinate our medical professionals first. So that we will get the data on the young children. It will take time. But right now, we've got a huge crisis. We've got to deal with those most at risk.
Kate Tulenko, the governor of New York State, Governor Andrew Cuomo, he is again considering shutting down indoor dining if hospitalization rates in that state don't stabilize soon. Why does indoor dining pose so much of a greater risk? Because I've seen some restaurants where there is social distancing. In fact, I've seen some restaurants where there are these barriers between tables, but still it poses a danger.
Well, I think it's too difficult for states to micromanage the restaurants. That's why I think you see them shutting them down. Because as you said, if there is appropriate social distancing, it is safer. But unfortunately, as people are eating, they can't wear a mask, they're talking in a loud environment, there's a lot of aerosol generated. So that's very high risk from a transmission point of view. And then you also have a lot of the wait staff and other staff who live in multi-generational households, and they can spread COVID to their families as well. So I do expect to see a lot more restaurant closures. And we have seen, as happened in April, when you do close restaurants and bars, it does reduce transmission. So you do get results.
Harry Hull, you know, we've been talking about the heavy burden that hospitals are facing because of the COVID-19 pandemic. A lot of the hospitals are up to capacity right now, and I'm wondering what kind of knock-on effect does this have on hospitals? Because they have to cater for other patients as well. There are people going in there on a daily basis. They could be going in there for a hip operation or for something like that. How does it affect the healthcare system?
Well, it affects it in a number of ways. One of the problems that hospitals have is just financing. When they are not doing these elective procedures, they're not generating revenue, and so the financing of a lot of these private hospitals or even public hospitals is precarious at this point in time. We also see that there's just fatigue because the medical staff have been working, for 9, 10 months now, taking care of very, very ill people, seeing lots of deaths. And they're at risk themselves, and so that's a tremendous psychological burden as well as the physical exhaustion from taking care of these people. And then there are equipment issues. There are still many places that don't have adequate personal protective equipment. Some places have been reusing it unwisely, but they don't have any other choice. And even in places where some of these shortages have been overcome, there aren't enough people to run the respirators, for example. We're also seeing that doctors and nurses and respiratory therapists and other people working in the hospital are staying home because either they've been exposed, or they've been infected, or they're getting sick. Or in some instances, they're just quitting because they're tired. And so it's a real strain on our healthcare system.
Joseph Williams, in just a few weeks, the government's relief program for people who've lost their jobs or have been furloughed, that program will expire. And we know that there are also thousands, tens of thousands of businesses that remain closed. What's the holdup with the relief program right now, the next relief program?
Well, it depends on who you ask. If you ask the Democrats, the holdup is Mitch McConnell. If you ask Mitch McConnell, the holdup is the White House. Now, negotiations have been restarted over the last few weeks where a bipartisan group of senators have gotten together and tried to hammer out a middle ground package. It looked like it was going to get some success. It was somewhere between the $500 billion that Mitch McConnell said he was agreed to and the 1.2 to 2.5 trillion that the Democrats wanted. This was somewhere in the 900 billion range. Joe Biden insisted that if that got passed, it would legitimately be a down payment. It would not be the be-all, end-all. Now, negotiations are still kind of grinding along, but Mitch McConnell has already signaled that he's not in favor of this, even as the White House signals to him that they want an additional $600 per week unemployment insurance sent to every American. An echoing of the program that happened earlier. It's necessary, it's needed in part because the restaurants are closing, because people should not be at them, and if you pay people or if you give them an incentive to stay home, they will do so. But it's still running the tension between the fiscal hawks who have now come out of hiding and the Democrats who understand that spending needs to happen, and a new president and an old president all in conflict, so there's really no leadership here until Biden gets sworn in. Then we may have clarity on what might happen.
Okay, and that's where we have to leave it. Thank you to all of you for being with us. That is it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.